This is Dr. Montalbano, and this is the second video in the series discussing knee osteoarthritis. In the first video I discussed the normal anatomy of the knee, and in this video I will be discussing the process of osteoarthritis. Osteoarthritis is a condition that affects primarily the hyaline cartilage. The hyaline cartilage is the material that covers the bone. In this model here, I'm not sure how well it shows up, but there is irregularities in the surface of the cartilage, which essentially is how osteoarthritis develops. The hyaline cartilage normally is a perfect surface. And when I say perfect, what I mean is that there's no cracks, there's no divots, there's no erosions. It looks like a porcelain surface, the same porcelain surface that you might experience in a bathroom. For instance, a new sink has a perfect porcelain surface. That's what articular cartilage normally looks like. When the surface begins to change and that smooth surface begins to become a roughened surface, and there's cracks in the surface, and then there's erosions in the surface, that is essentially what the process of osteoarthritis is. So this is an example here of mild osteoarthritis. And mild osteoarthritis is these small divots in the knee, these small erosions. As you can see, that there are no full thickness erosions in this particular model. If there were full thickness erosions, that would be representation of more advanced osteoarthritis. With this degree of osteoarthritis, the symptoms are generally pain with excessive activities, such as what one might experience if they were playing basketball or playing sports, possibly if they were walking very long distances, maybe hiking. During that activity, or at the end of that activity, they may experience some soreness in the knee while they were doing it, after they were doing it, or possibly the next day. Also, there may be some stiffness in the knee, and sometimes a sensation that the knee cracks or pops. The treatment for this degree of osteoarthritis is generally non-surgical. Activity modifications is often a way to manage the symptoms. Anti-inflammatory medications, over-the-counter anti-inflammatory medications or prescription medications, and also some strengthening exercises. Those are the fundamental treatments for mild osteoarthritis.